do you find a good health professional? That's a hard question. I don't think I've ever specifically found one that I feel really comfortable with. It's more that they presume that you're straight, which is, this is the norm, I guess, but I think it's that presuming that does affect a lot of people in the queer community.
You're often asked questions that are invasive or that wouldn't be asked of straight people. Healthcare workers kind of take you as an opportunity to educate them, which isn't really appropriate. So you'll be asked questions about your sex life or about your relationships in intimate ways that aren't related to your healthcare.
When I first came out to my GP, my family GP, who I had been seeing for my whole life, I transferred away from him to a different doctor because he told me that it was just a symptom of a mental illness and he wanted to treat me, cure me of being transgender by making me go through electromagnetic stimulation of the brain.
This dentist made assumptions based on the fact that in our conversation I had identified I was in a same-sex relationship, made assumptions about what sexual practices that would mean for me, and then proceeded to give me some advice, which I'm sure that he did not give to his other patients that came in, particularly not his heterosexual patients. So this was a dentist I didn't normally see. It made me feel very uncomfortable. It was all a bit creepy, and I certainly never wanted to engage with that dentist ever again.
They'll just ask a lot of unrelated questions to why you're actually seeing them. Like, I'll go in for foot pain and they'll ask me if I've had surgery, or they'll ask me about my genitals even. And it seems really unprofessional.
A really simple one is being asked in an appointment with a GP, are you sexually active? And then saying yes, and then being asked what you do for contraception, or if you use contraception, and saying I don't use contraception, and then having to explain that that's actually because my partner is assigned female at birth. It's not really a relevant question for me. And if those questions had been asked in a bit of a different way, I wouldn't then be in that sort of awkward position of having to explain myself in that way.
I was going in for some tests for some varicose veins, and I said that I was trans or transsexual man, and the clinician turned around and said to me, "Oh, you're one of those people. You need special privileges, do you?"
Some of my horror show experiences involve being told to my face that I am making my gender up for attention, that I don't exist, that I'm doomed to eternal unhappiness because society will never accept me or allow me to be who I am.
There are definite experiences of that sort of homophobic hostility, and it's mainly just been in terms of someone turning cold when they realise that I'm queer or that I'm bisexual, and being unfriendly. And so as far as experiences of discrimination goes, that might not sound that extreme, but in those vulnerable healthcare environments, that can actually be very unsettling.